Let's start with a surprising fact. Did you know that the way a drug works in your body can be influenced by everything from your diet to your genes? Today, we're diving into the basic principles of drug action to understand how medications interact with our bodies. First up, let's talk about pharmacokinetics. This is the study of what the body does to the drug. It involves four main processes: absorption, distribution, metabolism, and excretion. Absorption is the process by which drugs enter the bloodstream from their site of administration. The rate and extent of absorption can vary based on factors such as the route of administration, formulation of the drug, and physiological conditions. Once a drug is absorbed, it is distributed throughout the body. The extent of distribution depends on factors like blood flow, tissue permeability, and protein binding. Drugs that are highly protein-bound are less likely to cross cell membranes and reach their target sites. Most drugs are metabolized in the liver, where they are transformed into more water-soluble compounds that can be easily excreted. The rate of metabolism can be influenced by genetic factors, age, liver function, and interactions with other drugs. Drugs and their metabolites are eliminated from the body primarily through the kidneys, although other routes such as bile, sweat, and breath can also be involved. The rate of excretion can affect the duration of drug action. Now let's shift our focus to pharmacodynamics, which deals with what the drug does to the body. It involves the interaction of drugs with their target sites, such as receptors, enzymes, or ion channels, and the resulting biochemical and physiological effects. One key concept in pharmacodynamics is receptor theory. Most drugs exert their effects by binding to specific receptors on cells. The drug-receptor interaction can be agonistic, activating the receptor, antagonistic, blocking the receptor, or modulatory, altering the receptor's response to other substances. Another important concept is the dose-response relationship. This describes the change in effect on the body brought about by changing the dose. It is typically represented by a sigmoidal curve, where the effect increases with the dose until a maximum effect is reached. The therapeutic index is a measure of a drug's safety margin, calculated as the ratio of the lethal dose to the effective dose. A higher therapeutic index indicates a safer drug. Let's consider an example. Aspirin, a commonly used anti-inflammatory and analgesic drug. Aspirin is rapidly absorbed in the stomach and small intestine, distributed throughout the body, metabolized in the liver, and excreted by the kidneys. Its pharmacodynamic effect involves inhibiting the enzyme cyclooxygenase, which reduces the production of prostaglandins and thus decreases inflammation and pain. Understanding these principles allows healthcare professionals to predict how a drug will behave in the body, optimize dosing regimens, and anticipate potential interactions and side effects. By applying pharmacokinetic and pharmacodynamic principles, we can enhance the efficacy and safety of drug therapy. This ensures that patients receive the maximum benefit with minimal risk. It's important to note that individual factors such as age, weight, and existing health conditions can significantly influence how a drug acts in the body. Personalized medicine aims to tailor drug therapy to the individual's unique characteristics. Drug interactions can also play a crucial role. When two or more drugs are taken together, they can interact in ways that either enhance or diminish their effects. Understanding these interactions is vital for safe and effective drug use. Finally, let's talk about drug resistance. Over time, some drugs may become less effective as the body adapts to their presence. This is particularly relevant in the treatment of chronic conditions and infections. To sum up, the basic principles of drug action encompass both pharmacokinetics and pharmacodynamics. By understanding these processes, we can better predict and optimize the therapeutic effects of medications, ensuring safer and more effective treatment for patients. Remember, the key to effective drug therapy lies in understanding how drugs interact with the body and how individual factors can influence these interactions. This knowledge allows us to tailor treatments to each patient's unique needs, ensuring the best possible outcomes. As we continue to explore the world of pharmacology, keep in mind that every drug has its own unique profile and set of interactions. Staying informed and working closely with healthcare professionals is essential for safe and effective drug use. In our next lesson, we'll delve deeper into specific drug classes and their mechanisms of action. Understanding these will give you a comprehensive view of how different drugs work and their applications in treating various conditions.